I'm Dr. Lisa Iucci. I am a general surgeon and breast surgeon, board certified in general surgery, and I work here at the Premier Surgical Network. Breast cancer is overgrowth of cells, so your body typically has some turnover of cells that is natural, but if one of those cells gets unchecked and continues to grow in an unnatural way, it can cause a malignancy or a cancer in the breast, and then it has the potential to spread to other areas of your body. So something that patients should be aware of regarding breast cancer is following up for yearly screenings. It's very important. It's able to catch cancer early before you can see any physical signs of it, and it makes it more treatable. One of the things that we recommend is patients start their screening at age 40. However, if they have a first-degree relative that had breast cancer, then we do recommend they start screening 10 years prior to that family member's diagnosis. So say a family member was diagnosed with breast cancer at age 40, then you should start your screening at age 30 to just be sure that you are able to catch it if you do in fact have breast cancer as well. A lot of times breast cancer is actually asymptomatic. We're fortunate enough that a lot of people are getting yearly screenings and we find it before there are even any symptoms. But one of the things that you can look out for are skin changes, things that are different than your normal, redness, a swelling. Sometimes people describe the skin to look like the skin of an orange peel. That's something to be concerned about. Another thing that people find could be lymph nodes, either an enlarged node in their neck or in their axilla or armpit. A patient typically comes to us with a diagnosis of breast cancer or concerning finding. They're then referred to see one of our physicians here at Premier Surgical Network. If they do come to us with a biopsy already done that has concerning findings for malignancy, then we discuss the possible need for surgery. If they come to us with a mammogram finding or an ultrasound finding that has yet to be biopsied, we do the biopsies right here in the office if we're able to, and we can get them a diagnosis, and then again we discuss that pathology and what needs to be done next. Breast cancer has a lot of different treatment options. Every cancer is very specific to that patient and also the pathology that we find. One of the things that we do is we have a multidisciplinary tumor board that we discuss all of our patients with our team. A team includes our radiation oncologist, our medical oncologist, as well as caseworkers. And we go through every patient and figure out the best possible plan for them. It can range from a lumpectomy, which is a small excision of tissue, to a mastectomy, which is excision of the entire breast. And we also have the advantage here at Premier Surgical Network that we do have partners in plastic surgery, so we can also offer reconstruction at the time of cancer excision. Recovery from surgery for breast cancer is variable depending on the patient and what they require surrounding the surgical treatment of their cancer. So the surgical recovery from a lumpectomy or removal of some of the breast tissue is shorter. It's around 2 weeks. It's a smaller incision and there's less care afterwards. A mastectomy, which is removal of an entire breast, has a larger incision and therefore has a longer recovery time. But that's not the only thing to take into account in a patient's breast cancer journey. They may also require chemotherapy or radiation after surgery. And there's also a lot of people that are getting reconstruction at the time of surgery, and that may require a second procedure. So it's very personalized, but typically the entire journey, depending on that patient, is going to be about a year. One of the biggest benefits of being treated for breast cancer here at Premier Surgical Network is the community atmosphere that we hold. We are a very tight-knit group, the physicians that work here as well as our medical staff, and we see each patient individually. We don't have a lot of ancillary staff, so you get a very personalized approach to your care, but we also still have the resources that is needed to treat the breast cancer.